Welcome to the Deep Dive.
Hello.
Today we're looking into something really important for, well, so many of us who share our lives with pets, chronic kidney disease, or CKD, in dogs and cats.
And we've got a really comprehensive source guide on this, and our plan is basically to break it down for you.
Right. We want to unpack what CKD actually is, how it tends to creep up, maybe what subtle things you should be looking out for.
Yeah, and how vets figure it out, how it's diagnosed, and critically, how it's managed. The goal is to make sense of this complex condition.
Because it really is common, isn't it? Especially as our furry friends get a bit older.
Oh, definitely. It's a major age-related challenge. It's fundamentally this gradual, progressive decline in how well the kidneys are working.
And kidneys do so much more than people might think.
They really do. They're like the body's super filter, clearing waste out of the blood, but they also, balance electrolytes like phosphorus and potassium control hydration levels.
And hormones, too.
Exactly. Hormones for making red blood cells, hormones for managing blood pressure, they're vital.
So CKD means all those jobs start to falter, gradually.
Right. It's a slow burn, usually. The kidneys lose function bit by bit, and toxins start to build up in the system.
And that's what causes the problems we see.
That's a huge part of it, that toxin buildup. Now, the source material is clear. The damage itself, the loss of kidney tissue, that's irreversible. You can't get that back.
Okay.
But, and this is the key point, the condition is often very manageable. We shift focus from trying to cure it to slowing down that progression.
And keeping the pet feeling as good as possible for as long as possible.
Precisely. We're talking improving quality of life, sometimes for months, often for years, especially if caught early.
Okay, so if it's this slow decline, what actually kicks it off? What causes CKD?
Well, that's actually one of the frustrating parts. Often, especially in cats, we never find the exact trigger. The source calls this idiopathic CKD.
So sometimes you just don't know why it started.
A lot of the time, yeah. Aging itself, just the natural wear and tear on the kidneys over time, losing those filtering units, the nephrons, that's a big factor. But there are definitely known causes, too.
Like what?
Things pets might be born with, so congenital or hereditary problems, polycystic kidney disease, for example, that's common in Persian cats, or certain dog breeds might have familial kidney issues. Then there are things like chronic infections deep in the kidneys called pyelonephritis, that can lead to long-term damage.
And you mentioned toxins earlier. I was surprised by some of those.
Yeah, toxin exposure is a big one. And it includes things you might have right in your kitchen, like grapes and raisins, really toxic to kidneys.
Grapes and raisins, wow.
Also, certain human NSAIDs, those pain relievers, very dangerous for pets. And of course, antifreeze, ethylene glycol, that's extremely toxic. Vigilance is key.
Okay. Anything else on the cause list?
Sure. The source also mentions things like autoimmune diseases attacking the kidneys or conditions that cause inflammation in the little filters, the glomeruli, that's glomerulonephritis. And even chronic problems like blockages from kidney stones or urinary crystals can cause backup pressure and damage over time.
And genetics. You mentioned Persians. Are other breeds more susceptible?
Yeah, genetics definitely seem to play a role. The source highlights a few. Besides Persians, Abyssinians, and Siamese cats seem to have a higher incidence.
And dogs.
In dogs, bull terriers, and shih tzus are mentioned as having higher rates. Doesn't mean they will get it, of course, but it suggests maybe being extra watchful with screening as they age.
Okay, so we have the what and some potential whys. How does this kidney failure actually affect the rest of the pet's body? What goes wrong inside?
So the core problem is losing those nephrons, the tiny filtering units. At first, the body is pretty smart. The remaining nephrons actually get bigger and work harder to compensate.
Trying to pick up the slack.
Exactly.
Right.
But that extra workload eventually damages them too. It leads to scarring, inflammation, fibrosis, and that compensation just can't keep up forever.
And that's when the dominoes start to fall.
That's when you see the systemic problems. As filtering drops, waste products, specifically nitrogenous wastes like urea and creatinine, build up in the blood. That's the azotemia we mentioned.
Okay, the toxin buildup.
Right. Then you get electrolyte imbalances. Very commonly, phosphorus levels go up, which is bad, and potassium levels often drop too low. The body's acid-base balance gets thrown off often becomes too acidic, which we call metabolic acidosis, makes them feel pretty rotten.
And I remember reading about anemia being linked to CKD. How does that happen?
Good point. Healthy kidneys make a hormone, erythropoietin, or EPO. It tells the bone marrow, hey, make more red blood cells with CKD EPO production tanks. So you get this non-regenerative anemia. The body just isn't making enough red cells. That causes weakness, lethargy.
Makes sense. What about blood pressure?
Ah, yes, hypertension. High blood pressure is really common in CKD. And the source points out it's tricky because it can cause further kidney damage, but it can also be caused by the existing damage.
A vicious cycle.
Exactly. And one more key thing, proteinuria.
Protein in the urine.
Yeah, those damaged kidney filters, the glomeruli, start leaking protein like albumin that should stay in the blood. It spills out into the urine. That's a bad sign.
And vets use a staging system for all this.
Right, the IRIS stages. International Renal Interest Society. It goes from stage 1 very early to stage 4, which is end stage. It's based mainly on creatinine levels, but also SDMA, proteinuria, blood pressure. It helps guide treatment.
Okay, so lots going on inside. What might you, the owner, actually see at home? What are the signs to look out for?
This is so important because, as we said, the early signs can be really subtle. You might just think your pet is slowing down a bit because of age.
Insidious, the source called it.
It really can be. The absolute classic signs, the ones vets hear about most often, are increased thirst and increased urination. PUPD, we call it polyuria, polydipsia.
And why is that? Is it because the kidneys aren't concentrating the urine properly?
Exactly that. They're losing water because they can't make concentrated urine anymore, so they drink more to compensate, trying to stay hydrated. It's a key early warning sign.
What else?
Weight loss is very common. Even if they seem to be eating okay initially, though often appetite decreases too, or they become picky eaters. Lethargy, just less energy, less playful. That's typical.
Anything else that might crop up?
Vomiting can happen, nausea too, because of those toxins circulating. Sometimes you might notice bad breath, a specific kind of unpleasant smell called uremic breath.
Uremic breath, okay.
Oral ulcers can sometimes develop too. And as things progress, you might see signs of dehydration, even if they're drinking a lot, pale gums from the anemia we talked about, or just a generally poor, unkempt coat.
So it's quite a range of possible signs, and not every pet shows all of them.
Definitely not. And the signs usually get worse as the disease progresses. In really severe late-stage CKD, the toxin levels can get so high they affect the brain, leading to things like seizures, stumbling, collapse, or even coma.
Wow.
The big takeaway here is don't ignore subtle changes, especially increased thirst or urination, particularly in an older cat or dog. Get it checked out.
Right, so if you do bring your pet in with concerns, how does the vet actually pin down a CKD diagnosis? What's the process?
It's definitely not just one test. It's putting together clues from the history you give, the physical exam findings, and then, crucially, lab tests and sometimes imaging.
Blood tests are key, I assume.
Absolutely central. We look for those elevated kidney waste products, BUN and creatinine, which show azotemia. But there's another test the source highlights that's super important. SDMA.
SDMA.
Symmetric dimethylarginine. The exciting thing about SDMA is that it often goes up much earlier than creatinine when kidneys start to decline. It's a more sensitive marker for early detection. That's a huge advance.
This helps catch it sooner.
Potentially, yes. The blood panel also checks electrolytes, phosphorus, potassium, calcium, and a complete blood count, or CBC, looks for that anemia.
And urine tests, you mentioned those being important.
Equally vital. A urinalysis gives us so much information. A key finding is low urine-specific gravity, or USG. If the urine is dilute, like water, especially when the pet should be concentrating it because maybe they're a bit dehydrated, that's a big red flag for kidney dysfunction.
Below certain numbers.
Yeah, generally less than 1.030 in dogs or 1.035 in cats suggests poor concentrating ability. The urinalysis also looks for proteins, signs of infection, casts, things like that.
What about quantifying the protein?
Right, we use the urine protein-creatinine ratio, the UPC. It gives a number that tells us how much protein is being lost, which helps with staging and deciding on treatment.
Then blood pressure measurement.
Essential. Because hypertension is so common and damaging, checking blood pressure is standard procedure in a CKD workup.
Do vets ever need to look at the kidneys, like with x-rays or ultrasound?
Sometimes, yes. Imaging like abdominal ultrasound or radiographs lets us see the kidney size and shape. Look for structural problems like cysts, stones, tumors, blockages, things that might be causing or complicating the CKD.
Okay, so you gather all that data.
Exactly. Put it all together. History, exam, blood work with SDMA, urinalysis with UPC, blood pressure, maybe imaging. And that allows the vet to confirm the diagnosis and determine that IRIS stage we talked about.
Which then guides the treatment plan.
Yeah.
So let's talk about that. A diagnosis is made. What comes next? How do you manage CKD?
Well, remembering we can't cure it, the goals are to slow down the progression, manage the symptoms, and maintain the best possible quality of life. The source really stresses it's a multi-pronged approach tailored to the individual pet and their stage.
What's the foundation? What's most important?
Dietary management is absolutely cornerstone therapy. This almost always involves switching to a prescription renal or kidney diet.
And what's special about those diets?
They're carefully formulated. The key features are restricted levels of protein and, very importantly, phosphorus. Damaged kidneys struggle to handle excesses of those.
So less work for the kidneys.
Exactly. They're also usually supplemented with things like omega-3 fatty acids, which can have anti-inflammatory effects, antioxidants, and B vitamins, which can get depleted.
Getting a sick pet, especially a cat, to eat a new food sounds challenging.
Oh, it can be the biggest battle sometimes. Palatability is huge. Vets have lots of tricks, warming food, different textures, sometimes appetite stimulants are needed, but it's critical.
Okay, diet first. What else?
Hydration. Keeping them well hydrated is vital to help the kidneys flush toxins. Encouraging water intake using canned food which has more moisture, water fountains, adding flavoring to water all helps.
And fluids under the skin, sub-Q fluids.
Yes, subcutaneous fluids. Especially in the mid to later stages, many owners learn to give fluids under the skin at home. It provides really important support for hydration and kidney function.
What about medications? Are there drugs that help?
Definitely. Several classes are used depending on the lab results and symptoms. If phosphorus levels are still high despite the diet, we use phosphate binders, medications given with food that grab onto phosphorus and stop it being absorbed. Then there's blood pressure control. Antihypertensive drugs are crucial if the pet has high blood pressure. Amlodipine is very common for cats. For dogs, especially if they have that proteinuria, ACE inhibitors like benazepril or enalapril are often used. They help lower blood pressure and reduce protein loss in the urine.
What about treating the side effects, like the nausea or the anemia?
Yes, supportive medications are key for quality of life. For nausea and vomiting, drugs like meropitant, which is Cerenia, or ondansetron can make a huge difference. Mirtazapine is often used as an appetite stimulant too.
And the anemia?
If the anemia is severe enough to cause symptoms, sometimes injections of erythropoietin analogs like darbepoetin are used to stimulate red blood cell production, often needs iron supplements alongside it.
And that acidic blood issue, metabolic acidosis.
That can also be managed, often with oral supplements like sodium bicarbonate or potassium citrate, to help normalize the body's pH balance. It can make them feel quite a bit better.
Wow, it really is juggling a lot of different aspects.
It is. It takes commitment, careful monitoring, and really working closely with your vet. It's a team effort.
So thinking about that commitment, what's the outlook? What's the typical prognosis for a pet diagnosed with CKD? What should owners realistically prepare for?
That's a tough question because it really does vary so much. It depends heavily on the stage when it's diagnosed, how the pet responds to all these management strategies we just discussed, and whether there are other complicating factors like severe hypertension or really high protein loss.
But it's not necessarily an immediate death sentence.
Oh, absolutely not. Far from it, actually. The source material is quite encouraging here. With early diagnosis and dedicated, consistent management, many pets and cats in particular seem quite resilient, can live for years with a good quality of life.
Years, okay. That's hopeful.
It is. Now, if it's diagnosed at a very advanced stage, say stage 4, then yes, the survival time might be more limited, perhaps measured in months. But even then, focusing on palliative care, just keeping them comfortable, managing nausea, ensuring they're hydrated is incredibly important and valuable.
So catching it early really is the name of the game for a better long-term outlook.
It probably makes the single biggest difference, which leads us right into, well, not exactly prevention, but proactive care. How can we catch it early?
Regular vet checkups.
Absolutely paramount, especially for pets once they hit middle age and definitely into their senior years. These wellness exams aren't just about vaccines. They're the prime opportunity for screening tests.
Like the blood tests and urine tests we talked about.
Exactly. Routine blood work, including that sensitive SDMA marker, and a full urinalysis. These can pick up kidney changes long before you might notice anything wrong at home.
And the owner's role is crucial day to day, too.
Completely. The source really highlights how important owner education and involvement is. You need to know your pet's normal, how much they usually drink, urinate, their energy levels.
So you can spot subtle shifts.
Right. And you need to be comfortable giving medications, maybe those sub-Q fluids if needed. Regular follow-up appointments and lab tests are also vital. The source suggests rechecks every 3 to 6 months, typically, to monitor progress and tweak the treatment plan as needed.
Anything else on the prevention side?
Well, avoiding things known to harm kidneys is always smart. So being careful with potential toxins, using medications appropriately, and treating other conditions promptly, like urinary tract infections or blockages, before they can cause lasting kidney damage.
Okay, so let's try and bring this all together. Chronic kidney disease. It's common, it's progressive, it's definitely a challenge.
It is all those things. But, the really crucial insights are that while we can't turn back the clock on the damage, CKD is very often manageable. Understanding the condition, recognizing those early, often quiet signs.
Getting that thorough diagnosis.
Yes, and then committing to that tailored management plan. The diet, the hydration, the meds, the monitoring, it can make a world of difference.
To both how long they live and how well they live.
Absolutely. Quality of life is paramount. And that close relationship, that partnership with your veterinary team is just essential for navigating it all.
They really are your guides through this.
Couldn't do it without them. They tailor the plan, adjust it as needed, support you through the process.
Thinking about all this, especially the emphasis on early detection and how subtle the first signs are, it raises the question for me. Well, we know aging is the biggest risk factor. So maybe our approach to routine care for pets that aren't technically seniors yet, our middle-aged dogs and cats, maybe that needs to evolve. Should we perhaps be thinking about starting screening tests like SDMA and urinalysis even earlier, just as a standard part of wellness care, to catch things like CKD before they even have a chance to cause symptoms?
That's a really interesting thought. Definitely something worth considering and discussing with your own vet.